Hello, friends. We all love the carnivore diet, eating meat and healing from many of the untreatable health conditions and chronic diseases. But there is a bad news for us all. The carnivore diet could be banned really soon. Just like YouTube is doing with keto, same could happen with the carnivore diet in the next few days, erasing it off the entire platform. Well, what's really happening here? Let's find out. Although millions of people are healing from their long-lasting and untreatable chronic diseases by following the carnivore diet, there remains a strong lobby of big food and big pharma that is trying to get this diet totally banned. As the carnivore diet gains popularity, with countless testimonials and case studies demonstrating its effectiveness in reversing conditions like diabetes, heart issues, and various autoimmune disorders, it poses a significant threat to certain industries, which are profiting in billions from the sales of their artificial food supplements and expensive medications. Despite all its positive outcomes, the big pharma-backed critics of the carnivore diet claim that it causes some serious nutritional deficiencies to the human body. They have come up with over 100 of these supposed deficiencies with the carnivore diet and red meat, assumedly causing various life-threatening health conditions and chronic disorders. Now, the point to consider is, how valid are all these claims made by the carnivore critics? And more importantly, can a diet really be banned on YouTube in the pretext of such desperate statements? Well, to answer this crucial question, we reverted to the knowledge and findings of the top 3 carnivore experts in the world right now: Dr. Ken Berry, Dr. Anthony Chaffee, and Dr. Shawn Baker. And, to bring this whole fuss to a logical conclusion, in this exclusive video, we have picked the 15 most critical nutritional deficiencies associated with the carnivore diet, which the critics claim could deeply impact our vital health markers. We will expose the reality of each of these supposed deficiencies in a crisp and concise manner, telling you what it exactly means for us on the carnivore diet, and what is the opinion of the carnivore experts on this matter. It would be better if you watch this video with a bit more attention, as it is a matter of truth against the evil big pharma nexus. And to keep our carnivore community strong and thriving, do subscribe to our channel, helping us spread the healing message further. So friends, let's cut into the reality of these 15 deficiency claims and unearth the true healing potential of the carnivore diet. Number 1. Omega-3 fatty acid deficiency. Yes, you may not believe this, but omega-3 fatty acid deficiency is a big concern associated with the carnivore diet. Omega-3 are essential for brain health, reducing inflammation, and supporting cardiovascular health. Deficiencies of omega-3 can lead to cognitive decline, increased inflammation, and a higher risk of heart disease. Critics argue that the carnivore diet, which lacks plant-based omega-3 sources like flax seeds and chia seeds, is insufficient for our bodies. However, Dr. Ken Berry and Dr. Anthony Chaffee strongly highlight that animal-based sources of omega-3s, such as fatty fish, salmon, mackerel, and grass-fed beef, provide these essential fats in a highly bioavailable form. Dr. Berry explains, regular consumption of fatty fish and grass-fed meat ensures adequate omega-3 intake, promoting brain and heart health. Additionally, plant-based omega-3s, primarily in the form of ALA, alpha-linolenic acid, require conversion to EPA and DHA, the active forms, which is inefficient in humans. And for the knowledge of those who blindly advocate for the vegan diet, this conversion inefficiency can lead to suboptimal omega-3 levels in vegan diets. In contrast, the direct consumption of EPA and DHA from animal sources on the carnivore diet ensures better absorption and utilization, supporting overall health more effectively. Moving forward, let's examine the vastly debated topic of fiber deficiency on carnivore diet. Number 2. Fiber deficiency. Fiber deficiency is one of the most raised concerns about the carnivore diet, which excludes all plant-based foods, which are the primary source of dietary fiber. Fiber is believed to be crucial for digestive health, regular bowel movements, and the prevention of certain diseases like colon cancer. A lack of fiber can lead to constipation, digestive discomfort, and a higher risk of gastrointestinal diseases. However, top advocates of the carnivore diet, including Dr. Shawn Baker, argue that fiber is not essential for digestive health. They point to a strong anecdotal evidence from thousands of carnivore diet followers who report improved gut health and relief from other digestive conditions without any fiber intake. The elimination of plant fibers, in fact, reduces gut irritation and associated inflammation. Dr. Baker said in one of his videos, many people on the carnivore diet experience improved digestion without fiber, suggesting that the diet's nutrient-dense animal foods support a healthy gut. Moreover, recent studies indicate that excessive fiber intake, particularly from plant sources, can exacerbate gut issues in some individuals, suggesting that a high-fiber diet is not universally beneficial. This perspective challenges traditional views on fiber, proposing that a carnivore diet can maintain a much stronger digestive health through other mechanisms, such as optimizing gut microbiota and reducing inflammatory foods. Friends, we would highly encourage you to participate in this discussion and share your opinion and experiences related to the carnivore diet. Were you able to heal any health conditions, and what meal plan you commonly follow? Do tell in the comments. And now, transitioning to the deficiency of another essential nutrient associated with the carnivore diet. Number 3. Zinc deficiency. Zinc deficiency is a strongly highlighted issue for those following the carnivore diet, particularly due to the exclusion of legumes and whole grains, which are traditional sources of this mineral. Zinc is crucial for immune function, wound healing, DNA synthesis, and cell division. A deficiency in zinc can lead to weakened immunity, delayed wound healing, and growth retardation. Critics argue that without plant-based sources, the carnivore diet may lead to insufficient zinc intake. However, carnivore experts emphasize that animal products like beef, lamb, and shellfish are rich sources of zinc. Dr. Chaffee explains, regular consumption of zinc-rich foods like beef and shellfish ensures adequate intake, supporting immune function and overall health. Moreover, the bioavailability of zinc from animal sources is significantly higher than from plant sources, as plant-based diets often contain phytates that inhibit zinc absorption. Therefore, the carnivore diet, which includes a variety of nutrient-dense animal foods, provides sufficient zinc to meet dietary requirements and supports robust immune health. Moving on, let's discuss another crucial mineral highlighted by carnivore critics. Number 4. Magnesium deficiency. Magnesium deficiency is another critical risk associated with the carnivore diet. Magnesium plays a vital role in numerous bodily functions, including muscle and nerve function, blood sugar regulation, and bone health. A lack of magnesium can lead to muscle cramps, mental disorders, cardiovascular issues, and osteoporosis. Critics argue that the exclusion of magnesium-rich plant foods like nuts, seeds, and leafy greens makes the carnivore diet inadequate. However, experts such as Dr. Ken Berry and Dr. Anthony Chaffee counter this by emphasizing that animal products, including fish, meat, and especially organ meats, contain significant amounts of magnesium. Additionally, the carnivore diet's elimination of processed foods and its focus on whole, nutrient-dense animal foods enhances magnesium absorption and reduces the body's magnesium needs. Dr. Berry recommends incorporating mineral-rich foods like bone broth and organ meats can ensure sufficient magnesium intake. Interestingly, research has shown that the high oxalate content in some plant foods can bind to magnesium, reducing its absorption and increasing the risk of deficiency in plant-based diets. Therefore, focusing on these nutrient-dense animal foods allows individuals on the carnivore diet to maintain sufficient magnesium levels and avoid associated health issues. Now, let's delve into the concerns surrounding potassium deficiency. Number 5. Potassium deficiency. Potassium deficiency is also highlighted as a big issue for individuals on the carnivore diet, given the absence of fruits and vegetables that are traditional sources of this mineral. Potassium is essential for maintaining proper heart function, muscle contractions, and nerve signals. A deficiency in potassium can lead to serious health issues, including muscle weakness, fatigue, high blood pressure, and heart arrhythmias. Critics argue that without plant-based sources, those on the carnivore diet may suffer from low potassium levels. However, experts including Dr. Shawn Baker and Dr. Anthony Chaffee both emphasize that meat, particularly beef and lamb, contains substantial amounts of potassium required by our bodies. Moreover, the carnivore diet's ability to improve insulin sensitivity and reduce sodium retention can lower the body's potassium requirements. Dr. Chaffee states, consuming fatty cuts of meat and incorporating organ meats ensures adequate potassium intake. Furthermore, many plant-based foods contain anti-nutrients like phytic acid that can interfere with mineral absorption, making it challenging for vegans to maintain optimal potassium levels. This evidence suggests that, when properly planned, the carnivore diet easily meets our potassium needs and promotes cardiovascular and muscular health, thus effectively addressing all the concerns about potassium deficiency. Next, let's explore the concerns of carnivore critics related to deficiency of a crucial vitamin. Number 6. Vitamin D deficiency. Now this sounds pretty stupid, but vitamin D deficiency is a top concern among critics of the carnivore diet, given the diet's exclusion of fortified foods and limited exposure to sunlight, which are traditional sources of this essential nutrient. Vitamin D is crucial for maintaining bone health, supporting immune function, and regulating inflammation. A deficiency in vitamin D can lead to osteoporosis, rickets in children, and increased susceptibility to infections. Critics argue that without fortified foods or adequate sun exposure, the carnivore diet may lead to vitamin D deficiency. However, Dr. Ken Berry and Dr. Shawn Baker emphasize that fatty fish, such as salmon and mackerel, egg yolks, and beef liver, are rich natural sources of vitamin D. Dr. Berry notes, incorporating vitamin D-rich foods like fatty fish and egg yolks into your diet can help maintain adequate levels of this vital nutrient. Moreover, regular sun exposure can further boost vitamin D levels, ensuring that individuals on the carnivore diet meet their requirements. Interestingly, research indicates that vitamin D deficiencies are also prevalent in plant-based diets due to limited natural sources and poor absorption. By consuming nutrient-dense animal products and getting adequate sunlight, those on the carnivore diet can easily avoid vitamin D deficiency and support overall bone and immune health in a much superior way. This leads us to another essential vitamin often scrutinized in the carnivore diet. Number 7. Vitamin K2 deficiency. Yes, vitamin K. 2 deficiency is strongly highlighted by critics who argue that the carnivore diet lacks fermented foods, which are traditional sources of this vitamin. Vitamin K2 plays a crucial role in bone health and cardiovascular health by aiding in calcium utilization and preventing arterial calcification. A deficiency in vitamin K2 can lead to osteoporosis and an increased risk of heart disease. Critics suggest that without fermented foods, the carnivore diet may lead to insufficient vitamin K2 intake. However, experts like Dr. Anthony Chaffee and Dr. Ken Berry argue that animal products such as cheese, egg yolks, and fatty meats are excellent sources of vitamin K2. Dr. Chaffee explains, the diet's focus on nutrient-dense animal products like cheese ensures adequate vitamin K2 intake, supporting bone and heart health. Furthermore, vitamin K2 deficiencies can also be a concern in plant-based diets due to the limited bioavailability of plant-derived K1, which needs to be converted to K2 in the body, a process that is often inefficient. Therefore, the carnivore diet, rich in bioavailable vitamin K2 from animal sources, much effectively meets dietary needs and supports overall health. Next, let's discuss deficiency of another nutrient on carnivore diet. Number 8. Folate deficiency. Folate deficiency is frequently associated with the carnivore diet due to its exclusion of leafy greens, which are traditional sources of this nutrient. Folate is essential for DNA synthesis, repair, and cell division. A deficiency in folate can lead to megaloblastic anemia, birth defects, and increased risk of cardiovascular disease. Critics argue that without plant-based sources, the carnivore diet may lead to insufficient folate intake. However, Dr. Ken Berry and Dr. Anthony Chaffee highlight that certain cuts of meat and seafood, such as shellfish and lamb, are rich sources of folate, providing more than adequate amounts. Dr. Berry advises, including foods like shellfish and lamb can ensure sufficient folate intake, preventing anemia and supporting overall health. Interestingly, studies have shown that plant-based diets can also lead to folate deficiencies, particularly due to the presence of anti-nutrients that inhibit absorption. The carnivore diet, focusing on nutrient-dense animal products, provides ample folate, supporting cellular function and preventing deficiency-related health issues. Now, let's explore the concerns regarding deficiency of a vital mineral for our bone health. Number 9. Calcium deficiency. Yes, friends. Calcium deficiency is one of the most crucial issues for those on the carnivore diet, given the diet's exclusion of dairy and plant-based calcium sources. Calcium is crucial for our bone health, muscle function, and nerve transmission. A deficiency in calcium can lead to osteoporosis, muscle spasms, and dental problems. Critics claim that the lack of dairy and plant-based calcium sources could lead to insufficient calcium intake. However, carnivore experts argue that animal products such as bone-in cuts of meat, fish like sardines with bones, and mineral-rich bone broth provide bioavailable calcium. Dr. Baker states, consuming calcium-rich animal products like sardines with bones ensures adequate calcium levels, supporting bone health. Research suggests that plant-based diets often require supplementation to meet calcium needs due to lower bioavailability from plant sources. Additionally, the carnivore diet's emphasis on whole, unprocessed animal foods supports better calcium absorption and utilization. The carnivore diet, rich in bioavailable calcium from animal sources, effectively supports bone health, challenging the notion that it inherently leads to calcium deficiency. Moving on, let's delve into concerns about deficiency of another crucial vitamin. Number 10. Vitamin A deficiency. Vitamin A deficiency is raised as a potential issue for those on the carnivore diet, which excludes vegetables, traditional sources of beta-carotene, which is a precursor to vitamin A. Vitamin A is essential for vision, immune function, and skin health. A deficiency can lead to night blindness, immune dysfunction, and skin issues. Critics argue that without plant-based sources, the carnivore diet may lead to vitamin A deficiency. However, Dr. Ken Berry and Dr. Anthony Chaffee emphasize that animal products such as fatty fish, eggs, and butter are rich in bioavailable vitamin A, far superior to plant-based beta-carotene. Dr. Chaffee explains, regular consumption of foods like fatty fish and butter ensures sufficient vitamin A intake, supporting vision and immune health. Moreover, studies indicate that the conversion of beta-carotene to active vitamin A is inefficient in many individuals, making plant-based sources less reliable. The carnivore diet, with its emphasis on nutrient-dense animal products, provides adequate vitamin A to meet all our dietary needs and support overall health. This brings us to another crucial part of this discussion, vitamin E deficiency and its impact on health. Number 11. Vitamin E deficiency. Yes, friends. Vitamin E deficiency is another big point of concern for critics of the carnivore diet due to the exclusion of nuts, seeds, and plant oils, which are traditional sources of this nutrient. Vitamin E acts as a powerful antioxidant, protecting cells from oxidative damage and supporting immune function. A deficiency in vitamin E can lead to weakened immune response, neurological problems, and skin issues. Critics argue that the lack of plant-based sources might lead to inadequate vitamin E intake. However, carnivore experts highlight that animal fats, including those found in meats and dairy products, contain sufficient amounts of vitamin E. Dr. Berry states, incorporating nutrient-rich animal fats like those found in lamb fat and beef tallow ensures adequate vitamin E intake. Moreover, the reduced oxidative stress associated with a low-carb, high-fat carnivore diet decreases the body's demand for vitamin E. Interestingly, some studies suggest that plant-based diets can also lead to vitamin E deficiencies due to poor absorption and the presence of anti-nutrients. By focusing on nutrient-dense animal products, the carnivore diet provides sufficient vitamin E to support overall health and prevent deficiency-related issues. Next, we'll discuss deficiency of an essential mineral for thyroid function. Number 12. Iodine deficiency. Iodine deficiency is another concern for those following the carnivore diet, particularly due to the exclusion of sea vegetables and iodized salt, which are traditional sources of this mineral. Iodine is crucial for the production of thyroid hormones, which regulate metabolism, growth, and development. A deficiency in iodine can lead to goiter, hypothyroidism, and developmental issues in children. Carnivore critics argue that without these sources, the carnivore diet may result in iodine deficiency. However, experts including Dr. Shawn Baker and Dr. Ken Berry strongly emphasize that seafood, particularly fish and shellfish, are rich sources of iodine. Dr. Baker notes regular consumption of iodine-rich foods like seafood ensures adequate iodine intake, supporting thyroid health. Additionally, using iodized salt in cooking can further help meet dietary iodine needs. Research indicates that plant-based diets can also be at risk for iodine deficiency due to limited natural sources and the presence of goitrogens in certain vegetables that can interfere with iodine utilization. Therefore, by including seafood and iodized salt, the carnivore diet can effectively prevent iodine deficiency and support thyroid function in a prompt manner. Moving to the last three on our list, let's explore the concerns regarding selenium deficiency on the carnivore diet. Number 13. Selenium deficiency. Selenium deficiency is often highlighted by critics who argue that the carnivore diet may lack sufficient sources of this essential mineral. Selenium is vital for thyroid function, antioxidant defense, and immune response. A deficiency in selenium can lead to thyroid dysfunction, weakened immunity, and increased oxidative stress. Critics suggest that without plant-based sources, the carnivore diet might be inadequate in selenium. However, Dr. Ken Berry and Dr. Anthony Chaffee both emphasize that animal products such as fish, especially tuna and salmon, beef and poultry, are excellent sources of selenium. Dr. Chaffee explains, incorporating selenium-rich foods like fish and poultry ensures adequate intake, supporting thyroid and immune health. Furthermore, selenium deficiencies can also occur in plant-based diets due to the variability of selenium content in soil, affecting the levels found in plant foods. The carnivore diet, rich in bioavailable selenium from animal sources, effectively meets dietary needs and supports overall wellness. Moving forward, number 14. Thiamine deficiency. Thiamine deficiency is a concern frequently associated with diets that exclude whole grains and legumes, which are traditional sources of this nutrient. Thiamine, also known as vitamin B1, is essential for energy metabolism and nervous system function. A deficiency in thiamine can lead to conditions such as beriberi and Wernicke-Korsakoff syndrome, characterized by symptoms like fatigue, nerve damage, and cognitive impairment. Critics argue that the carnivore diet, which excludes these plant-based sources, may lead to thiamine deficiency. However, proponents like Dr. Shawn Baker and Dr. Ken Berry highlight that animal products such as beef and fish are rich sources of thiamine. Dr. Berry notes, regular consumption of thiamine-rich foods like lamb and fish ensures adequate intake, supporting energy metabolism and nervous system health. Research indicates that the bioavailability of thiamine from animal sources is high, making it easier for the body to absorb and utilize. Interestingly, plant-based diets can also face thiamine deficiencies due to the presence of anti-nutrients that inhibit its absorption. Thus, the carnivore diet, with its focus on nutrient-dense animal products, provides sufficient thiamine to meet dietary needs and support long-term wellness. And now, let's explore the last on our list of deficiencies associated with the carnivore diet. Number 15. Vitamin C deficiency. Last but not the least, vitamin C deficiency is cited as a major concern for those following the carnivore diet, which excludes fruits and vegetables, traditional sources of this vital nutrient. Vitamin C is crucial for collagen synthesis, immune function, and acts as a potent antioxidant. Without sufficient vitamin C, individuals are at risk of developing scurvy, which manifests with symptoms like bleeding gums, joint pain, and severe fatigue. However, top proponents of the carnivore diet strongly argue that fresh meat, particularly organ meats such as liver, contains small but adequate amounts of vitamin C. They also highlight that the body's requirement for vitamin C decreases when carbohydrate intake is minimized due to reduced oxidative stress and lower insulin levels. Dr. Baker points out, historical evidence shows that indigenous populations relying heavily on animal products did not suffer from scurvy, indicating that fresh meat provides sufficient vitamin C. Interestingly, some studies suggest that plant-based diets may lead to suboptimal levels of vitamin C due to poor absorption and the presence of anti-nutrients that hinder nutrient uptake. Thus, with proper selection of nutrient-dense animal products, the carnivore diet effectively prevents vitamin C deficiency and saves us from all the associated health risks and hazards. So friends, now that we have discussed the top 15 nutritional deficiencies falsely associated with the carnivore diet, we have a pretty clear vision of what is right for us. What is your opinion about this whole matter? What has been your experience with the carnivore diet? Which health conditions and diseases have you cured so far? Do share your journey with us in the comments. If you agree to the healing capabilities of the carnivore diet and its actual benefits, press the thumbs up button to show your support and appreciation. And subscribe to our channel for more of such informative and useful videos related to your vital health and wellness. And do you know, what are the 20 deadly diseases which the carnivore diet quickly heals? Watch the video showing up on the screen right now to find that out. See you.